Let's begin with the first section of our lecture, which is the acute infections of the larynx. So in this section, we will discuss about acute laryngitis, also acute membranous laryngitis and epiglottitis, and also acute laryngo-tracheo-bronchitis. All these are acute infections of the larynx, trachea and the bronchi, and then we will talk about how they present and how we can manage and treat these conditions. So first, the acute laryngitis. The causes of acute laryngitis are acute inflammation or acute infection of the larynx it is further divided into two types. One is infectious causes of acute laryngitis, and then non-infectious causes of acute laryngitis. So infectious type, what are the different infections that can lead to acute laryngitis? It's very common, is viral in origin. So viruses are most common cause of acute laryngitis. Example, whenever there is common cold or viral infections, influenza, flu, all these can cause acute laryngitis also. So viral infection is very common cause of acute laryngitis. Then usually it follows the upper respiratory tract infection also. Whenever there is infection of the upper respiratory tract, nose, sinuses, then we have the pharynx. These infections sometimes lead to the infection of the larynx also, causing acute laryngitis. Then we have some bacteria that can cause acute laryngitis, and these are Streptococcus pneumoniae and Haemophilus influenzae. These are common bacteria that can cause acute laryngitis. Exanthematous diseases and fevers like childhood infections, measles, chicken pox, whooping cough, all these can cause also acute laryngitis because they can involve the respiratory tract. Then some non-infectious type of acute laryngitis, again due to vocal abuse or allergies. Different allergies, people who are allergic to pollens, dust, different other things, they can get acute laryngitis. And abuse of voice, people who have the work when they talk or too much talking and abuse of the vocal cords can also cause the acute laryngitis. Due to thermal or chemical burn to larynx, and due to inhalation or ingestion of various substances that can also cause acute laryngitis. Lot of people who have work, like people who are singers and who are like actors, they usually avoid different food substances also. Too much sour food, too much spicy food, food that can affect their voice and affect the larynx. So different food substances can lead to laryngitis also. So these are some very common causes of laryngitis, in which we have infectious causes and then we have some non-infectious causes also. And as a result of laryngitis, there is redness, swelling in the epiglottis and in the arytenoid folds, and also the different surrounding areas of the larynx, causing edema and swelling. Also due to laryngeal trauma such as endotracheal intubation. So after endotracheal intubation, there is trauma to the larynx also, and even the intubation is removed, the patient feels that tenderness and hoarseness in the voice also after some time until the proper healing occurs. So all these are infectious and non-infectious causes of acute laryngitis. Clinical features are hoarseness or sometimes complete loss of voice also, and I have seen some patients that have complete loss of voice and it lasts for a long time sometimes. Usually they have no voice and it is there for a period of months and sometimes year also. So this can cause also complete loss of voice. So hoarseness, complete loss of voice. Discomfort or pain in the throat is other important clinical feature. Dry, irritating cough, dry cough, no mucus, not productive cough, but there is dry cough, and patient feels irritation or feeling of some foreign body in the throat also. Heat, cold, and rawness. Head cold and rawness is there. So head cold is there. And then we have malaise and fever. Fever and malaise is also present. Patient have fever. Usually fever accompanies all the infections that are present. So fever and malaise can also be present. Again, there is laryngeal appearance vary with severity. Again, the appearance of the larynx on examination vary. If it's mild condition, maybe the appearance is not as bad. Symptoms are not as bad as with the progress of the disease and when it becomes severe. So this is the normal larynx you can see, and this is the inflamed larynx all around. There is swelling, and this is the normal. These are the vocal cords, and this is the epiglottis. Here you can see epiglottis and then the vocal cords present. As a result of swelling, there is narrowing also. Early stages, usually the patient have erythema and edema of epiglottis. So on examination, there is redness and swelling present. Airy epiglottic folds, arytenoids and ventricular bands. Vocal cords are white and near normal in shape in the early stages, but there is erythema, redness of all the surrounding areas of the airy epiglottic folds, of arytenoids and ventricular bands. Later in the progress, once the disease progresses, again there is hyperemia and swelling increases, red and swollen vocal cords, sticky secretions, vocal abuse, submucosal hemorrhages occur as a result of abuse of the voice. So whenever there is vocal abuse, in the cases when the disease is severe, usually there is submucosal hemorrhages occur. So there is submucosal bleeding occur as a result of the abuse of the voice. So all these are the mild condition. You can see the difference very clearly when the condition is mild and when it's severe. So there is redness, hyperemia, swelling, sticky secretion. So once the disease progresses, on physical examination or on examination of the larynx, usually the patient has these differences you can see. Treatment of acute laryngitis is vocal rest, very important. Ask the patient to rest, don't talk. Vocal rest is helpful to bring the changes present in the larynx back to normal. So vocal rest is very important. Then avoidance of smoking or alcohol if the patient is smoker. Steam inhalations. Steam inhalations are very, very effective for this acute laryngitis with tincture benzoin and oil of eucalyptus. Cough sedatives, antibiotics, analgesics, and steroids are also effective for acute laryngitis. Then another condition, acute condition of the larynx is the acute membranous laryngitis, and as the name shows, there is formation of the membrane in this condition. This condition is similar to acute membranous tonsillitis caused by pyogenic non-specific organisms. So it's similar to acute membranous tonsillitis. In that condition also the membrane is formed on the tonsils. So here also the membrane is formed. May begin in the larynx or may extend from the pharynx into the larynx. Differentiated from laryngeal diphtheria. Laryngeal diphtheria we will discuss later on. Again is a condition caused by Corynebacterium diphtheriae that leads to the formation of membrane. So all the conditions in which there is formation of membrane, whether it's membranous tonsillitis or membranous laryngitis, make sure it is important to differentiate from the diphtheria infection because diphtheria also lead to the formation of the membrane. Acute epiglottitis. Epiglottitis is the inflammation of the epiglottis, which is the flap that covers the opening once the food is entering into the esophagus. So that's epiglottis. Is an acute inflammatory condition confined to the supraglottic structure, that is epiglottis, epiglottic folds and arytenoids. There is marked edema of these structures which may obstruct the airways. So in this the infection is limited to supraglottic area, which is epiglottis, epiglottic folds, arytenoid folds. So all these are inflamed, swollen, red, and once they are all swollen it can cause obstruction of the airway. I mentioned once the food enters the esophagus, it covers and closes the trachea to avoid the entrance of food into the respiratory tract. So once it is swollen or inflamed and becomes big and edematous, it naturally will come and cause obstruction of the respiratory tract. So this can cause respiratory obstruction and obstruct the airway. Etiology of acute epiglottitis is it's common in children of 2 to 7 years. Also affects adults. Haemophilus influenza type B is the most common cause. Haemophilus influenza, which is the cause of influenza, is very, very common cause of epiglottitis. Clinical features is abrupt in onset, rapid progression, and there is acute epiglottitis, throat dysphagia, difficulty in swallowing, dyspnea and stridor. Because of obstruction of the airway, there is difficulty in breathing and stridor. Fever, and there is also sometimes septicemia when the infection spread to the bloodstream and different parts of the body. Examination. On examination with the tongue depressor, ask the patient to open the mouth, press the tongue with the help of this tongue depressor, and once you examine the throat, you see all the redness, inflammation, swelling. So tongue depressor may show red and swollen epiglottis. Indirect laryngoscopy, which is examination of the larynx, may show edema, congestion of supraglottic structure. Intubation in OT is another method of examination, and then we can also use soft tissue x-ray of the neck. So all these are different. Very commonly when the patient comes and visit the doctor in the outpatient, they examine the throat with the help of tongue depressor and the torchlight, and they can see the swelling and redness in the throat, and that's the very, very common first step in the diagnosis, and then they can start the treatment with antibiotics and different things. Then indirect laryngoscopy, another method, again very, very helpful, may show edema and congestion of the supraglottic structure. And then we have other intubation is in OT to see more deeply and clearly when the patient is in operation theater. So these are different methods of examination for the condition. Also may show, X-ray can show the swollen epiglottis also. Treatment of acute epiglottitis again depend on whether it's a mild condition, severe condition. As the condition progress to severity causing airway obstruction, then we need more further advanced treatments. First, hospitalization, antibiotic, steroids can be used. Then we have adequate hydration is important, humidification and oxygen. And then in the end, we can need intubation or tracheostomy if the patient is not getting better with all these different treatment options. Then acute laryngo-tracheo-bronchitis is the acute infection that involves the larynx, trachea, and the bronchi. So we have the trachea and the lungs, and they have the trachea divides into right and left bronchi, which goes into each lung. So this is the healthy airway, and you can see if there is inflammation, there is all redness, swelling, and cause narrowing of the lumen. So inflammation of the larynx, trachea, and bronchi more common than acute epiglottitis. Etiology is a viral infection, affects children between 6 months and 3 years, especially this influenza type 1 and 2, very common in children. Male children more often affected, and secondary bacterial infection by gram-positive cocci. Gram-positive cocci usually occurs after the infection. So viral is the common, then superimposed bacterial infection can occur mostly in children, and then male children are more commonly affected. Pathology is how this occur. There is loose areolar tissue in subglottic region which swells up, respiratory obstruction and stridor occur. Coupled with thick secretions and crust, whenever there is infection, we went over all these infections of the nasal cavity and then pharynx, we noticed that there is increased secretions, increased mucus production that also cause obstruction overhead of the narrowing caused by the swelling. So there is narrowing caused by the swelling leads to obstruction, then we have thick secretions and leads to the crusts. May occlude airway. So these all different things. So we have the normal larynx. This is the normal larynx. We have the vocal cords, and then this is the one with the infection that can cause croup. Symptomatology is starts as upper respiratory tract infection. There is hoarseness of the voice and croupy cough, fever, difficulty in breathing. There is stridor present, especially on inhalation, suprasternal and intercostal recession because of obstruction, difficulty in breathing. There is suprasternal, sternum is the bone in the middle, suprasternal is this portion. Then we have intercostal in between the ribs. There is recession, all that because of the difficulty in breathing and dyspnea. Treatment again is the hospitalization, very important. Antibiotics, because usually these patients need IV antibiotics, and for that hospitalization for IV infusions to treat dehydration is important. Humidification, parenteral fluids, IV fluids, steroids, hydrocortisone, then adrenaline, and intubation or tracheostomy again at the end if breathing is really affected. So that was all about the section 1, in which we talked about all the acute infections that affects the larynx, trachea, bronchi and epiglottis. Thank you for watching sqadia.com.